Well, it just seems only appropriate that we talk about fall prevention in the fall. It's a nice time to grab a really catchy title, but there's so much more to it than that. We have people here who know about an opportunity for you to learn how to do the things that we do better and prevent some of those things from happening. And you've met Cindy Quinn before. She's been here. She's the actually evidence-based program coordinator as a part of the our public health as part of the university, and with her is Rachel Foster. She's a trainer in that same evidence-based program, and so thank you both for coming today. Really appreciate it.
Thank you. We're glad to be here, Sharon.
Well, and you've got an event coming up on September 24th that we need to find out more about. So start by talking a little bit about that.
Well, before we do talk about that, could I talk a little bit about falls?
Sure.
And what's happening nationally with falls in this wonderful, beautiful country of ours. So one of the things that we have been addressing over the last several years here in the Brazos Valley is preventing falls, especially among an older adult population, or as Rachel and I say, the chronologically superior population.
Love that.
Yes. And so there are just some statistics that are staggering, I think, for the United States, and also staggering for the state of Texas. And some of the stats would include, in the state of Texas, we spent in 2011 almost $3 billion on fall-related injury hospitalization for the older adult population. That didn't include when they go home and they need to see their doctor and have physical therapy visits and whatnot. That number can be reduced greatly. And so we do know that falls can be devastating. It can take away quality of life. We know that falls are also costly. In the United States, in 2020, we're looking at almost $67 billion they're projecting that we will spend on hospitalizations for fall-related injuries. But what we do know is that falls are preventable. So we have been working on the prevention aspect here in the Brazos Valley. And Rachel has been planning a Fall Prevention Awareness Day. It's actually a nationally recognized day for September 23rd, but we're planning our event to be September 24th. So I'm going to let Rachel tell you some more about that.
Good, Rachel. Tell us, and give us some ideas about preventing falls. If you've found out some techniques, we'll whet our appetite a little bit.
Okay. Yeah, so we're very excited to create this event around the National Fall Prevention Month of September, like you said, to celebrate the coming of fall. And we're really grateful that the City of College Station is willing to host this event at the Southwood Community Center. So it will be Wednesday, September 24th from 9 to 12. And that address is 1520 Rock Prairie Road in College Station. And so in this event, we're going to be talking about things that you can do to prevent falls, like making sure that your home will be safe and clutter-free. How do we go about doing that and making that a priority? We talk about the importance of medication management, the importance of staying physically active, because we know that we increase our risk of falls, because if we're not active and our muscles become weak, we increase our risk for falls.
So am I hearing you say that many of the falls we're talking about are a result of perhaps our medication that we're on? We don't understand what can happen on that particular type of medicine. And on this meeting on the 24th, will there be some explanation regarding each of these things?
Yes, so we're very excited because we'll have some time from 10 to 12 during that time period. We're going to have presentation, and one of the presentation is going to be given by the Golden Star Pharmacy, and they're going to come and talk specifically about the importance of medication management and how sometimes medication can put us at risk for falls due to their side effects or the complications, or if we're not following the instructions on how to take them. So that was one of the topics that we're going to be presenting during that day. Also, we're going to have a presentation on home safety done by Steve Wilson from Interim Healthcare. We're also going to have a presentation on the importance of staying physically active, and that presentation is going to be given by St. Joseph Dizzy and Balance Clinic.
And I didn't even know there was a Dizzy and Balance Clinic.
So if you come,
Very
and you'll be able
clinic.
to see what they offer and what they do. And St. Joseph has been a great supporter in this event in years past, and we're glad that they are willing to do this.
Is there a cost for attending?
Everything is absolutely free. So they'll be able to come. Also, with the free, we get to, from 9 to 10, we're going to do some free health screenings. And those free health screenings are going to include a fall risk assessment done by St. Joseph. The College Station Medical Center is also going to be doing some blood pressure screening, some other screening. We're also going to have a really exciting imaging done by someone from the Texas A&M Health Science Center, where we'll kind of give you an idea of what's going on with your brain. And as
Well,
you're
that may
walking,
be scary.
and so
No, it's all good.
it's really, really exciting, because then you can see what's going on as we are multitasking sometimes, and how that can put us at risk for falling.
Well, on
so
our
all of
screen-
these things could be free.
On our screen, we've got the information Fall Prevention Awareness Day, September the 24th, 9 to noon, Southwood Community Center in College Station. And for more information, here's a phone number, 979-458-4269, or this website has all of this and so much more that we haven't had an opportunity to cover today. You can see it in detail, sph.tamhsc.edu. So it's just that simple. Ladies, thanks for what you're doing
Thank
for our
you.
community.
Thank you.
Such a pleasure.
Thank you.